Good afternoon, everyone. We're gathered here on Treaty 6 territory, and I would like to also acknowledge the Métis people who share a deep connection to this land. I'm joined today by Dr. Ariane Letellian and 3 of her colleagues who are resident doctors training in obstetrics and gynecology here in Edmonton. Just a few weeks ago, on International Women's Day, I was so proud to stand alongside our Alberta NDP women MLAs when our leader, Rachel Notley, promised that should the Alberta NDP form the next government, we will offer universal access to free prescription contraception across the province. And since that historic announcement, we've heard from so many Albertans about how this policy would be truly life-changing. And although a recent poll showed nearly 3/4 of Albertans support prescription birth control, Danielle Smith and her UCP government have refused to consider this life-changing policy, with the Premier brushing it aside by saying that a vast majority of prescription drugs are already covered under private plans. Well, that's simply not true, and a lot of Albertans cannot afford private insurance plans. They deserve a lot better than this. Albertans like Nikki, who wrote to me to tell me that she's paying $189 a month for her private health insurance plan, and she still has to come up with another $1,000 a month for prescriptions that aren't covered. Or Darlene, who wondered if the Premier is aware that plans like Blue Cross are not free. She says that it's just simply not affordable when you're barely scraping by. And clearly, Danielle Smith must be someone who's never struggled to make ends meet. Amy from Calgary wrote saying that she spent over $6,000 on hormonal birth control alone. Shelby, who's a university student, says that birth control isn't covered by her healthcare provider. Jenny said, as a self-employed single mother who pays for private coverage, I can tell you it's not cheap and it's not fair. Offering universal access to free prescription contraception is good health policy, it's good economic policy, and it's the right thing to do. Universal access to prescription contraception in Alberta will ensure that more women and more Albertans are in control of their lives and their economic future. This program would cover oral hormone pills, contraceptive injections, copper and hormonal IUDs, subdermal implants, and Plan B. The savings for Albertans without prescription plans from their employer would be immediate, ranging from $240 per year for oral hormone pills to upwards of $500 for IUDs. And for someone buying the pill every month, this program will save them up to $10,000 over their lifetime. Based on the cost of a similar program in BC, we estimate the cost of this coverage to be around $33 million per year. And in addition to BC, we see this type of coverage in Australia, New Zealand, the UK, and some Scandinavian countries as well. The Alberta NDP will make this coverage available in Alberta. But with more on this, I would love to turn things over to Dr. Letellian.
Thank you, Janis. I'm a resident doctor training in obstetrics and gynecology at the University of Alberta. I am currently in my 3rd year of training here in Edmonton. I am joined today here by Dr. Sophia Marani, Dr. Darian Peruza, and Dr. Sky Russell, who are also resident physicians in OBGYN training with me at the University of Alberta. We are here today in our capacity as future obstetrician gynecologists to support the Alberta NDP's proposal to fund free prescription contraception for all Albertans. Being here today is neither part of our formal training nor part of our regular work week in the hospital, but it was important for us to stand up for a cause that matters so much to our patients. As resident physicians, counseling women about contraception is part of our job. We are taught to ask about a patient's past medical history and assess which types of birth control they have tried in the past. We ask about their medications and allergies. We ask about their goals and preferences. But inevitably, as part of our counseling, we also have to ask, do you have drug coverage? It's simple. Cost influences the decisions that Albertans make about birth control every single day. We know this because we see it as part of our work. The most effective forms of contraception, such as the hormonal IUD and the contraceptive implant, are also the most expensive to purchase upfront. When patients are told that they will have to pay more than $400 out of pocket for an IUD, some understandably turn to cheaper forms of birth control, even if these other options are known to be less effective or to have more side effects. This is unfair, and frankly, it is heartbreaking to see as a doctor. Albertans deserve the type of birth control that's right for them, not just the one that they can afford. From a purely economical perspective, universal access to contraception also makes sense. Unplanned pregnancies are very expensive. Delivering a baby in the hospital can cost, to the public system, up to $5,000 for vaginal delivery and up to $10,000 for a C-section. A 2010 report from a BC group found that every dollar spent on contraception could help save up to $90 in social supports after an unplanned pregnancy. When you know how much society benefits when contraception is widely accessible, it makes sense to share the financial responsibility for it. Today is April 2nd. As of yesterday, prescription birth control is available for free in all of British Columbia. We are encouraged to see this and hopeful that Alberta can follow in BC's footsteps. There is momentum building and support across the province for this initiative. The UCP cannot ignore it for much longer. We thank Emily Irwin for her leadership with regards to free contraception in Alberta and for having us here today. She has been a strong advocate for reproductive rights and for patients that we see every day at work. Thank you.
Thank you so much to Dr. Letelian and to her fantastic colleagues who are supporting us today. It's clear that all Albertans deserve health care that's there for them when and where they need it. Our recently released family health team strategy includes recommendations to integrate primary care with community and social services and provide more extensive mental health care. This team-based care approach will provide comprehensive health care to all Albertans. And should we have the opportunity to form government after the next election, the Alberta NDP will ensure that our comprehensive health care plan includes free prescription contraception across the province. Thank you so much for being here, and we are so happy to answer any of your questions today.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. We'll start with questions in the room.
I was wondering if we could hear from one of the doctors that could maybe just tell us any in-person stories that they perhaps have heard from people who use contraceptives in the province.
I'd love that. I can tell you I've heard from countless, mostly young Albertan women who've shared some pretty heartbreaking stories, so I can imagine these doctors on the front lines could absolutely share.
So just just in general, I would say, like, when we counsel patients about contraception, the hormonal IUD is typically a pretty popular choice because it carries a lot of benefits for the patient, such as kind of less painful periods or a decreased people's flow. So people are generally very excited to hear about the hormonal IUD, and oftentimes when they hear that they will have to shell out, upwards of $400 to pay for a hormonal IUD, then it's just really sad to see the look of disappointment in their eyes and just kind of ask, what are the other options that would be cheaper? And initially they had come into the office, wanting to discuss new forms of contraception because maybe the contraception that they were on wasn't the right fit for them, and then they kind of have to settle and say, maybe I'll just stay on the form of contraception that I'm on right now. And so it's really heartbreaking to see how cost can have such an effect and prevent patients from really receiving the optimal contraception that they would like to get.
And I was also wondering if you could talk about just the price range for people who maybe don't use it or aren't familiar with it. People think maybe birth control is like $25, $30, but if you could just talk about the range in terms of the different types.
Absolutely. So I don't know as much about the oral contraceptive pill in terms of how much it retails for out of pocket. My understanding is it would be definitely under $50 a month. I did call my local pharmacy last week to ask how much a hormonal IUD would be, and I was told $409 without drug coverage. The subdermal implant is also several hundreds of dollars. The copper IUD you can get for under $100 in certain places. But for the vast majority of contraceptive options, we're talking about close to $100, if not upwards of $100 upfront. And if it's something that you have to pay for every month, then it definitely adds up over the months, yeah.
Because birth control is often something people start using in their teens and could last them, anywhere from 5 to 10 years. So I was just wondering if you could talk about the longevity of why the NDP wants to have this plan.
Yeah, and I'm happy for Janis to talk about a little bit why it's important to the NDP. But what I can say is, covering contraception is definitely benefits more than just the individual. So there's a lot of societal benefits to having free access to prescription contraception. So for example, you can save a lot of money in social supports, you can save money to the public healthcare system. There's also many ways in which prescription contraception can be used to treat certain medical conditions or even prevent things like ovarian and uterine cancers. And so it saves money to the public system in more than one ways. And so even though it may seem like a small way to save money for individuals in the short run, it actually saves society a lot in the long run.
That was a wonderful answer, and I mean she's absolutely right, and I think it is an important point, and that a lot of Albertans have raised with us that it is about more than actual contraception too. I've heard from countless Albertans who use prescription birth control for pelvic pain, for flow. For trans Albertans, the use of contraception can also be gender affirming. So I mean and as Dr. L'Italien said as well, it's the individual benefits, but it's also the broader societal benefits.
Thank you. Any more questions on the floor? Okay, we'll do one more pass for questions. Just a reminder, if you're on Zoom, it's raise hand. If you're on the phone, it's *9. Seeing none, that concludes our press conference for today. Thank you.
For watching, and to learn more, check out albertasfuture.ca.